Assalamualaikum and a very good evening. Welcome back everyone to Real Conversations with Anita, where we break the silence, challenge the stigma, and do a deep into the realities of mental health, resilience, and the power of lived experience and advocacy. Now, every Wednesday at 6 p.m, we provide a platform where we share insights on stories that matter, conversations that transform, and insights that challenge our perspectives, because we believe that every voice deserves to be heard and every story has the power to inspire. Now, today we are incredibly honored to have with us a remarkable woman who has dedicated most of her life to advancing human rights, education, and social justice. Now, our guest today is Professor Dato Noor Aziah Mohd Awal. I would like to acknowledge her accomplishments and also experience, Prof. She is a distinguished legal scholar, pioneering academic, and a true change maker. She is a contract professor of law at the University Kebangsaan of Malaysia, a trailblazer who has broken numerous barriers throughout her career. From being the first female appointed to the Islamic Religious Council of Negeri Sembilan, my mom is from Negeri Sembilan, proud of you, to serving as a Malaysian representative to the ASEAN Commission on the Promotion and Protection of the Rights of Women and Children, Prof. Aziah embodies what it means to advocate for meaningful social change. Now, today, we will explore her incredible journey and discuss a critical topic close to all of our hearts: humanizing mental health care through advocacy and education. Thank you so much, Prof. Aziah, for being with us at Real Conversations with Anita. How are you?
Alhamdulillah. Thank you very much for having me today.
Alhamdulillah. Terima kasih, Prof. Sudi datang ke Konti MIASA Malaysia. Welcome. Alhamdulillah. We are absolutely thrilled to have you, and we look forward to having this conversation, Prof. Okay, so to kick it off here, Prof, we know that you have had an impressive career. Kita dah sebut dah tadi, spanning from law, education, and leadership roles. So you have made significant contributions, alhamdulillah, in multiple areas, and we would like obviously to deep dive into this conversation with you today. Now, if we can kick it off, if you can tell us a little bit about your incredible work, what are you currently working on? In your own words as well, if you can describe to our listeners, who is Noor Aziah Binti Mohd Awal, Prof. Silakan.
Terima kasih. Well, to begin with, I'm an educator. Yeah,
yes.
I started off as a tutor in
Alhamdulillah.
UKM, and I've served University Kebangsaan Malaysia at the law faculty for 36 years.
MashaAllah.
And I retired in 2021. I'm not an ordinary academician. I've been involved with a lot of NGO, and my main work was with MIASA Islamiyah at that time, where I was the chairman or pengerusi of Majlis Perunding Wanita Islam Malaysia from 2013 to 2019. But I was with Yadim, I think, since year 2000. I'm working with them, doing a lot of ceramah, particularly on women issues. And that's how I started. Because when I first came to the law faculty, my dean said, "Why don't you teach family law?" And I said, okay. So I pick it up from there. And at that time, Malaysia baru saja just recently introduced Islamic family law, enactment Undang Keluarga Islam and all that. And what I did was I taught my student both civil for non-Muslims, the family law, and then Muslim family law for Muslim students and those who wanted to practice in the Sharia court. And from there, I think I became very passionate about issue of women and looking at the sufferings of women. And I think even at that time, there was so many issues on mental health regarding women in family matters.
Of course.
Yeah, and that started off my work in human rights issues for women in particular.
When you were with Yadim?
It's voluntary work.
Of course.
Yeah. And I do a lot of talks throughout Malaysia. So I give talks on rights of women, how women could get a divorce. We had so many cases of gantung tak bertali. You know, they didn't know how to get access to the Sharia court. And mind you, those days, I think most Sharia judges are male, and one way or the other, the male, biasness are there in some ways. And then a lot of all these women NGO came into, and I became one of the first NGO writers of CEDAW report for NGOs, CEDAW alternative report. and I get involved with a lot of issues of enacting Islamic family law enactments of the states, and also various issues on domestic violence. I was involved in the Domestic Violence
That's
Act.
incredible work, Prof.
And that is something coming from the ground, and I think that was the first statute in Malaysia that come from the ground. It goes up.
What was most memorable for you?
Memorable and hardest was trying to get a woman to go to the Sharia court. I mean, they are being abused by abusive husbands, whether physically, mentally, or sexually, and try to get them to the
court,
not to the court first, to the police station,
the police first.
Make a police report, and
just to be open, just to consider that first.
That is the greatest challenge, and getting some of the abusive husband knocking on your doors and saying, how dare you talk to my wife, and this, that, and the other. Oh my goodness. I mean, my office is this in UKM, and people who knows me would just come charging, and I do have people even within the university, you know, that would tell me off and say, don't you interfere with my married life and things like that. And I said, if you walk into my room, I'll call the securities or I'll call the police.
You know the law.
Yes. So I mean, that is challenging. And also, by the time we make a police report, getting them to court was a greatest challenge.
Another challenge.
Because a lot of women will end up saying, oh, I want to withdraw my report. I didn't want my husband to go to the prison, stuff like that. And that is very challenging to me. And then also looking, you know, watching women being left just like that, deserted by their husband, and then looking after 5-6 children on their own, single mothers. They're not divorced, but they have managed to pick up the pieces, and all the children go to university. And to me, that is something need to be done. And from that, I work it out with the NGOs, with the government, and how we manage even to set up Bahagian Sokongan Keluarga at JKSM. Syariah Court has been given a much better perspective and more accessible, and then many female judges are also in the Syariah Court now.
Alhamdulillah. So we see a lot of progress then, Prof. Azal. Alhamdulillah. Now, Prof, tell me a little bit more. It's very interesting hearing you speak about the challenges of women, not only of course going to the courts, but going to the police first and then withdrawing ataupun maybe retracting these reports. Why does this commonly happen? What are maybe one of the more main causes of this?
I think generally it's our culture. Our culture is that it's taboo to even talk about divorce, number one. Number two is that you go to the police and talk about how bad you have been treated, then it's like reflecting you're a bad wife.
I see.
A lot of the battered woman syndrome woman feels that it is
their fault.
They have not done well.
They deserve this.
And to them, this is, husband has a right to command you to do this, that, and the other. And when I gave them talk, actually we are equal amongst before God, men and women are equal. Kita sama, lelaki dan perempuan, yang membezakan
ada peranan masing-masing.
And kita ada peranan, and we complement each other.
Yes, that's correct.
But dalam Islam pun, dalam dari sudut rumah tangga, when I told them, look, husband, yes, head of family, but everything must be musyawarah, mesti dibincangkan bersama, even issue of children. And even for sexual relationships, you have your offer and acceptance kind of thing, and that is to make it more mawadah warahmah, and the sakinah will come into it kalau kita berjaya dalam melalui proses komunikasi itu. So to me, that is very important. A lot of women have this feeling that kalau dia kahwin, dia kena taat pada suami, serve the husband. Like, you're not a slave. Yang hanya yang menjadi hamba ialah kepada Allah Subhanahu Wa Taala. Manusia tak boleh sujud kepada manusia yang lain. So that is very important. Bagi saya, suami isteri itu sama tarafnya. Dia ada complementary role. Itulah yang sangat penting dalam rumah tangga. Dan culture itu, it's not easy to turunkan tembok batu yang sangat besar mengelilingi kehidupan keluarga. And you make them, you educate them. Hari-hari you campaign that this is woman's right. This is what you should know about marriage. And to me now, we have changed.
I think sometimes, I can kind of resonate in the sense where kadang-kadang that taat tu dia a bit blurry in that sense, especially bila yelah abuse berlaku pun kadang-kadang isteri tak berapa faham lagi, and I think it takes a certain education juga. And like what you said, sometimes we also feel that maybe we deserve it, husband has the right, benda-benda macam tu berlaku lah, that mindset. Okay, thank you very much, Prof. Mungkin a little bit, Prof, on your aspirations as well, tapi sebelum tu, where does this drive come from? Adakah daripada kecil nak menjadi advocate? Mungkin kita nak cerita sikit your journey heading towards that, bagaimana berlaku tu.
My father is an imam, imam kampung for 25 years. So I grew up in a family of biasa pergi masjid, dan zaman saya membesar itu, I think imam tu macam tempat orang datang mengadu. I have seen my father solemnize the marriage. Kalau bergaduh pun datang rumah, tak ada makanan kat rumah pun dia come to the house. So to me, that come from watching my father helping people out, and then sampai hantar mereka ke pejabat agama, kalau nak bercerai.
Very normal scene for you.
Yes, I have seen that, and itu menyebabkan saya rasa, and my father always remind me, dia kata kalau kita tolong satu orang, suatu masa nanti ramai orang akan tolong kita juga. Kalau dia tak pergi kepada ayah, dia kata it will go to you, to my grandchildren. Dia kata buat baik itu satu perkara yang akan datang balik kebaikan tu pada kita. That is something that I always remember. Then when I finish my SPM, kan, dapat tawaran keluar negara. I did my A-level in England. I come from sekolah dekat Nilai, sekolah biasa, sekolah harian, and then I'm from the art streams, but to be offered a scholarship to do law, I did well in my SPM, but I never thought that at that time government hantar all the science stream students
sahaja
to England. So when I got the offer, I said betul ke ni? You know, my father said no, this is an opportunity. And you just imagine budak kampung, anak Pak Imam, and I asked my father, you will allow me to go to England? Yes, it is for your education, for your future, and you will take us out and you will change the world. So to me that's very important.
17 years old?
Yes, I was 17. Masa tu nak masak nasi pun masih belajar. And I have to learn how to cook because kita hidup sendiri, kan. And true enough, being the youngest daughter out of 10 siblings, kan, to me it's a good opportunity, and I learn a lot of things.
What about maybe some mental health challenges on your side, Prof? Pernah tak lalu?
I think masa when I did my A-level, because I've never had any experience.
Being far away, being independent,
I miss my
17 years old, miss your mom, of
and
course.
I miss my mom and my dad.
Huge family pula tu.
And then call is very expensive.
Betul.
I remember when I went there for like 3 months, my brother pun ambil lah telefon, letak telefon kat rumah saya, so I can call my parents. And I call them Hari Raya. This is real experience. I angkat telefon, I spoke to my father. Then when I spoke to my mother cried, I also cried. Then my father said, okay, cry first, let me talk to her. This is a very
expensive call. Yeah, betul.
So itu, but to me it's like that communication is very important.
Betul.
If you don't have a telephone at that time, oh my goodness, the suffering was pain. It was painful.
Imagine during your time, during my time pun, Prof, it was like when I was in the US, kalau call mak pun mungkin setahun sekali, 2 kali.
Yes.
That was
I only call her for Hari Raya, and that's about it.
That's about it, kan? MashaAllah. Okay, Prof, mungkin one last question before we break into our first ni. Can you share with us maybe going to the work that you're in right now with SUHAKAM, kan, being a national human rights institution, SUHAKAM has done so much. Tapi mungkin if you can share with our listeners, viewers juga, what are maybe some key issues or cases that SUHAKAM has been dealing so far, and also are there any particular challenges you faced in advocating for human rights ataupun advancing human rights dekat Malaysia ni?
I think our most recent work is on citizenship issues lah. That one before the amendments to the constitution, and I think that one has the greatest challenge. We even do a lot of advocacy, trying to explain to people why we need amendments to the constitution. We even end up meeting the Council of Rulers just to explain that this amendment should go or this one should not, and things like that. I think that is very important to us, not only for women, because
For everyone.
Yeah, it is the first time that woman now can actually pass her citizenship to her children born abroad, and she's marrying a foreigner. That's very important. And the other issues that we are also looking into in terms of is the indigenous people in Malaysia. We do have a lot of work with the indigenous people, the orang asli and all that. But now it's a lot of them are being having to face a lot of problems in terms of tanah dia kena ambil, because of the development.
Very common story.
Yeah, so that one I think it's challenging, because even when we want to go into the orang asli community, we need to ask for permissions. Even even we are part of the Human Rights Commission, and we need to even talk to Yakwa, get permission and things like that. But I think that is something that we are still working on. An issue of women in general, we have a lot of issues on the areas of CEDAW. I think the conflict between not conflict, I think the differences between the civil and the Sharia laws, there are some misunderstanding, to me misunderstanding in terms of rights and so on. And we are gradually pushing forward so that Muslim women have also better rights in terms of what is already there in the Quran and all that, so that they can fully exercise their rights according to the religion.
What about refugees?
We do.
Prof? Refugees as well?
We have a lot of work with refugees, and our main concern is that I think SUHAKAM has been pushing for the government to sign the 1951 convention, and also we really we've been pleading, please have a formal policy on refugees. At the moment, we don't think government has any policy on refugees. We allowed them in, we gave them, but they are not allowed to work, they are not allowed to even open an account, and they can be easily exploited. And we do know there are a lot of trafficking cases and all that. So these are, and of course young girls are being trafficked in, refugees, children being trafficked into the country for marriages and all that. As one case to us is a real trafficking cases, but in the end, when we found out, and we managed to get her out of the police lockup, and then we said, look, she needs to be given back to her family if she has one. Otherwise, this refugees group are going to be the main focus of exploitation. So we see this. SUHAKAM work very well with the community, refugees community. We in fact have sessions with them like 3 times a year, and we visited all the refugees community throughout Malaysia, particularly the Rohingyas. But we are trying to gradually, and we hope government will introduce the Directive 23 soon as possible, so that it can work, and they would be able to settle in a few places. And our worry, I think, in SUHAKAM is the xenophobia. The Malaysians are having a lot of problem of accepting refugees. They felt that refugees are taking their rights, but it's not.
Their portion.
We're not giving them. We're not giving anything to refugees except place to live. Then if they can allowed to work, then they are self-sustained.
Of course, it is for their livelihood as well. Okay, thank you very much, Prof. Aziah. We will like to talk to you a little bit more about mental health after this, but we need to take a short break. Thank you very much, Prof. Aziah, for your sharing. Thank you so much, everyone. We are today talking with Prof. Dato Noor Aziah Binti Mohd Awal with our topic heading towards humanizing mental health care, advocacy and education. We will be right back, everyone. So you spoke a little bit about SUHAKAM's, concentration. We spoke about citizenship, refugee issues, women, and all of that. Now, we want to talk a little bit more about mental health, of course. And nak tengok sikit kalau boleh, Prof. Aziah. SUHAKAM punya responsibility in advising government, when it comes to laws and procedures. When we talk about mental health policies, where is SUHAKAM at in this issue?
I think I would explain to SUHAKAM. Actually, at the moment we have 10 commissioners.
Okay.
One of it is children commissioner. Yang I was the first children commissioner. Dr. Farah is the second. And kalau children, they just look at children issue.
Okay.
The rest of us, the 9 plus 1 chairman, we are divided into the 3 divisions that we have.
Okay.
We have education and promotion division. We have complaint and monitoring, and we also have law and policy.
Okay.
So these 3 divisions, so we are divided into the 8 of us, 2 to each group, so something like that.
Okay.
And complaint, I'm in the complaint and
monitoring.
I was with children, then I came to complaint and monitoring. And in complaint and monitoring, we do a lot of work visiting prisons,
Right.
look up. We do inquiries when there is death in custody and things like that.
Okay.
And that's when we encounter, in prison in particular, a lot of mental health issues.
Okay.
A lot of the prisoners are suffering from mental health issues. We don't know whether when they come in or whether
Was it the experience
they
being
were
in prison?
already having mental health issues before they
Right.
went into prison.
So no assessment is being made before someone goes into prison.
Usually yes.
Usually
when you're
yes.
in charge, if
Okay.
you say if you plead insanity,
Of course.
for example,
Yep.
right? Particularly cases where a son could kill the father,
Murder
or the
cases.
murder
Yep.
cases, and we have cases, of course, infanticide when mother, she
Harm the
gave
child.
birth, Yang itu pun she has to plead insanity. Kita tak ada pun. Macam certain countries dia ada even premenstrual tension is a defense in some countries, but kat Malaysia you just have to plead insanity. So for insanity you will be assessed, you will be taken to the, hospital bahagia, you will be spending time there, they assess whether betul ke tidak you are insane as such. Sebab itu when people talk about mental health, people ingat orang gila. No,
Betul.
that's the problem. I think it's the stigma that make people refuse to go to see a psychiatrist.
Yes.
Kita banyak kali lah advise. I mean, from my own experience pun, saya akan advise, saya nak cadang kakak pergi jumpa seorang psychiatrist. Tak, kakak tak gila. Dia kata. So, kadang-kadang kita have to explain kenapa dia patut pergi to see a psychiatrist or a counselor.
Alright.
So akan dalam proses kerja itu kita dapati bila dia dah dijatuhkan hukuman, dia gradually menjadi, sometimes maybe because of solitary confinement.
Yes, of course.
Lama-lama menjadi lebih.
Kita duduk COVID pun rasa macam tu, bayangkan duduk dalam solitary confinement.
And then in fact masa COVID, when we did our little survey, we noticed that masa COVID we noticed that orang bercerai sangat tinggi.
Yes.
A lot of incest cases.
Betul.
And we also have realized that people becoming, they are not mentally healthy.
Yes, of course.
Because sitting, just being
freedom being stripped away.
Sepatutnya duduk bersama keluarga tu mawadah, warahmah, sakinah, hidup berkasih.
Tapi benda lain diambil.
Yes. Jadi dari segi itu mereka terkurung sebulan, 2 bulan. That is dangerous as well. So itulah antara kerja-kerja SUHAKAM, and that's how we encountered into issue of mental health ini. And then when I was student commissioner, we had I think couple of workshops looking at children's mental health because of during COVID, and secondly because of there were quite an increase of suicides.
Yes, definitely.
So and then it relate to bullies, issue like that. So lepas itu kita rasakan this mental health issue needs to
be addressed,
and to be looked at properly. Somebody has to sit down and talk about it. When in terms of prison, kita dah banyak kali lah berbincang. We have the hospital, Kementerian Kesihatan. We have the prison punya hospitals, dan juga sebab semua prison ada klinik dan hospital dia sendiri. But at the same time, there's a
tapi it's not enough, Prof.
No, the thing is prison tak sesuai nak jaga mental health patient. But bagi prison sepatutnya, dan bagi Kementerian Kesihatan pula, kalau dia ada mental health, dia tak masuk prison pun in the first place. But bila dia dah masuk, dia ada mental health, dia tak nak terima. So we still have this tarik tali lah,
tug and pull
thing. And we feel that every time kita pergi melawat penjara tu, kita rasa this group of people mesti diletakkan di tempat yang lain, bukannya di penjara.
When you are unwell, you need to be treated as a person
Dan
who is unwell.
perkara tu hanya timbul, maybe dia dah memang ada mental health issues, tapi masa dia buat test sebelum dia kena charge tu, it's not tak terkeluar. They were not able to trace that. Tak masuk prison, yes.
Yes, you nampak. And it intensifies as well when you are in such a situation, kan, of course.
So yang itu saya rasa kita, that's how SUHAKAM get to talk about it. I mean, kita ada, we are looking at CRPD, kan, Convention on Right of Person with Disabilities, dan kita juga sedang dalam usaha untuk menyediakan laporan untuk tahun hadapan untuk CRPD.
Right.
Dan kita tahu government tak pernah hantar pun.
Tak pernah.
Dan sekarang ini yang saya difahamkan, Akta Kesihatan Mental tu pun sedang untuk Akta Kurang Upaya sedang nak dipinda.
Yes, dipinda, betul.
Dan kita memang nak masukkan elemen-elemen ini, sebab bagi saya akta tu sebelum ini, bagi orang kurang upaya ni, dia sangat tertumpu kepada yang fizikal.
Betul.
Dan saya rasa kita perlulah, saya ingat, memasukkan mental health issues.
Yes.
Even saya kita rasa sangat gembira lah bila Perdana Menteri masa bajet talk about autism children, bagi a certain budget. Tapi that's one area of
from the many.
Yes. So saya rasa pun penerangan mengenai the different types of mental health issues ni perlu dibuat dan perlu ada peruntukan untuk setiap section.
Betul. Thank you very much, Prof. Aziah. I think there was so much that you said in just that one question. So mungkin saya ambil beberapa dekat sini untuk nak kupas ke soalan seterusnya, ya, Prof. Aziah. Okay, I think what is very heartwarming to hear adalah, okay, kita maklum, we acknowledge that people in prison either sebelum ataupun waktu sedang menjalani penghukuman tu ada mental challenges and issues, but what are the actions ataupun actionable steps? Ini penting sebenarnya, sebab kita dekat MIASA pun kita ada counsellors yang dah pernah kerja dalam prison, so we have gambaran tu, kita tahu sebenarnya apa yang berlaku. Visiting psychiatrist ada, tapi berjarak-jarak, tidak sesuai dan sebagainya lah. So there are a lot of issues in that sense. Tapi yang penting yang I would like to pull from you is issues when we talk about mothers yang melalui apa yang kita panggil postpartum psychosis. Betul? Tetapi sebenarnya it is a clinical condition yang perlu dirawat sebenarnya. And apabila tidak dirawat, maka berlakulah situasi-situasi yang tidak diingini, kemudian menjalani penghukuman walhal pada waktu itu mereka dalam keadaan tidak sedar. So I think these are some of the things that kita perlu lebih awareness, Prof, dan mereka yang orang kata mendapat hukuman begini, kita patut memberikan mereka the right of getting that treatment, because mereka bukan criminal in that sense, because at the act of them doing it, mereka tidak sedar pun sebenarnya. And I think this awareness lah yang kita nak cuba ketengahkan sebenarnya, Prof. Okay, yang keduanya I like to pull, ya, Prof. Aziah, bila kita bercakap tentang UNCRPD tu satu, of course, United Nations Convention on Rights of Persons with Disabilities, tetapi juga PWD Act, Persons with Disabilities Act 2008. Dan kalau kita tengok kepada Mental Health Act sendiri 2001, kemudian Mental Health Regulations came in to support it in 2010, and also there were amendments done to the Mental Health Act 2 tahun lepas sebenarnya. Tetapi sebenarnya sekarang ni, Prof. Aziah, like what you mentioned as well, tak ada banyak provisions when we talk about disabilities yang melibatkan mereka yang ada OKU mental lah, the category of mental, and also how all these acts are not in line with human rights ataupun human rights standards ataupun international law. Jadi sebab itu all these amendments must be made in line with UNCRPD. Okay, now Prof. Aziah, mungkin on SUHAKAM punya side, apa sebenarnya yang melambatkan the government of sending this country report out despite the ratification of UNCRPD ni dah lama berlaku? Dan macam mana kita nak pressure SUHAKAM juga untuk pressure government sebenarnya, sebab kami on the ground, we see injustices happening every single day, Prof. Aziah.
Actually, kita pun merasakan I mean, on government side, I think SIDO pun kita
Betul.
walaupun hantar report banyak delay. I think last year was the time that we have combined like 5 reports baru
Yes.
kita table, and Alhamdulillah,
Alhamdulillah.
it's good. Dan I was there when it
Yes.
was table. Dan insyaAllah this year I think the CRC at the moment I think they are doing a pre-session sekarang. Dr. Farhanini is in Geneva to do the pre-session, and she probably will go again in June
Okay.
to do the CRC. CRC pun we have a lot of gaps, right? And CRPD, so unfortunately, is like bukan saja gap, we have not tried to
Yes.
implement one. I think the current minister is seriously going to, she said, well, this year we definitely
Okay.
will start doing the work on CRPD, and we want to send a report.
Okay.
And I really hoping that, like SIDO, ministry will also call us for consultations.
They must.
Supaya report tu jadi of course NGOs are open. You can write your report, send it to Geneva. We have the session untuk NGO and all that. By all means, please send all your alternative reports. And you are being given like 5 minutes, 3 minutes
Yes.
to talk about whatever area that you really want to highlight.
To highlight,
And
betul.
I think for MIASA, I think the mental health issue should be your focus. Take the 5 minutes, really push for it. And for SUHAKAM, I think we will also look into this area. We are now we have started writing the reports since last year.
Okay.
We have a staff doing that, really focusing on CRPD.
Okay.
But what the delay, I mean, I do not have to say no excuses. But,
Betul.
we
want to move forward,
we
kan?
want to move forward.
Yes.
So, as far as I'm concerned, as SUHAKAM as well, we are also pushing towards this.
Alhamdulillah.
And we are trying to make sure that ours will be a very fair kind of report, that we cover all the areas of CRPD rather than just looking at physical or
Betul. Alhamdulillah.
certain
Okay.
areas. So that is very important. And of course, we have been involved in the amendment of the CRPD's Act, the Person with Disability Act. It's now being amended. I think
Yes.
our staff has been going for consultations and all that.
Alhamdulillah.
And we really hope that it's like better, much better than what it was. And to move forward, I think I mean, even SUHAKAM, I think we need to rigorously work together with
Yes,
NGOs,
betul.
do a lot of campaign, a lot of work to make people aware that, mental health issues, you're not, bukan gila.
Betul.
I think the word used insane is to me.
No,
even
that one
you-
must be removed already.
You
Yeah.
don't use the word insane.
Betul.
Because in criminal matters, nak jadi defend, insanity is like, oh my goodness, it's like you're being, that's it, you're going to the hospital bahagia, and that's it, you're there forever. But to me, you must look at the cause why it happened. And we also now have to work together with community in terms of, and there are a lot of countries that have mental health patients. It's a community based.
Yes,
How they help
of
them.
course.
And I think community based is very good. Malaysia can work that out. I'm sure we can, but we must start from now.
Yes.
We must do the campaign so that there is no stigma. People will
Yeah.
say, be careful, this person that just came out from the hospital. But we do have cases where they have been treated, they are now free to be released, to be with the community, but they have to take medication and all that.
Yeah.
So that is something that is the responsibility of families. You must be responsible neighbors.
Betul.
And I think community would be able to help mental health patients well when as soon as they are well enough to be with the community.
Yep,
But at the
definitely.
same time, those who have, like, to me, is like minor cases, is the community that help.
Yeah.
But in Malaysia, I think it's the reverse. If you get into the community, you get back to the same thing or get worse.
Same environment.
You end up in the hospital again. So we need to change the mental, how can I say, kita kena ubah minda masyarakat memandang orang yang
Ada penyakit
masalah mental, tetapi bukan menganggap mereka gila.
Betul.
Sebenarnya orang yang ada masalah mental ini adalah pesakit yang perlu dirawat dan perlu sokongan keluarga
Betul.
yang sangat.
Betul. Thank you very much, Prof Aziah. Macam biasalah, so many things that you just said. Couple of things. One, we look forward to reading the country report, where we hope it is a neutral, non-biased, true reflection of what is the current state. Saya rasa ni penting, dan peranan SUHAKAM lah dalam ni untuk memastikan ini tepat. Dan kedua, I think insyaAllah, amin, keduanya adalah for us, it is more about knowing what is in the country report, barulah kami boleh memberikan feedback, and the parallel report can come out. Jadi tanpa kami tahu kandungan country report pun susah juga kan, nanti dia jadi macam chicken and egg kind of situation as well. Itu pertama. I think keduanya adalah Prof, when I hear you speak about insanity clause dan sebagainya, I think benda-benda ni mungkin juga boleh dianggap sesuatu yang negatif juga, in the sense where people would want to resort to the insanity clause juga kan, to get away with things. So how do we kind of balance that as well? Sebab saya rasa apa yang kami nampak daripada MIASA sendiri, ini banyak berlaku. Sebab when there are cases on the news, some of them actually come to MIASA dan mereka nak didiagnose menjadi ada penyakit mental because they want to run away. So we witness that first hand juga sebenarnya. Itu kedua. Now ketiganya, Prof, adalah everything that you just said. How do we humanize mental health ni sebenarnya, Prof? I mean, you spoke a lot. Tadi Prof dah sebut secara surface, mungkin daripada segi stigma, education, jangan cepat melabel, approach kita dan sebagainya. But and also community-based support, itu yang penting. And this is one of the recommendations of WHO sebenarnya, because kita kena expand community support, because recovery is in the community sebenarnya. And like what you said, I mean, family ada peranan, rakan-rakan ada peranan, tempat kerja ada peranan, community peranan sangat besar. Sebab kalau kita tidak menerima, maka sudah tentu orang yang sedang bergelut tu, how do they come back to the community and lead quality lives? How do they contribute? Sama dengan a very good example I would say adalah mereka yang dulunya terjebak dengan dadah contoh. They're already sober, they want to change, they want to contribute, they want to work, tetapi tidak diberikan peluang tersebut. True. Sebab mereka dianggap sebagai sampah masyarakat, Prof. Jadi in your view and your experience, collectively as a community, apa yang kita boleh lakukan, Prof, sebenarnya?
Saya rasa it takes some time. Dia bukan boleh buat overnight.
Betul.
My experience, saya visited Kajang prison, women prison tu since year 2000, tahun 2000, and the last I went untuk beri khidmat nasihat dan bagi ceramah kepada bantuan wanita itu was January 2020.
Okay.
So for 20 years, I have been going to Kajang prison every month. I talk to the woman yang dalam tu. And I even met banduan akhir yang nak melalui proses penggantungan and all that. Now, bila mereka dibebaskan daripada penjara, nak diterima oleh masyarakat sangat susah. Sampai dengan rakan-rakan di UKM, kita buat halfway house for bekas banduan perempuan. Kita buka ada rumah semi-D dekat Kajang, Bukit Kajang tu. We run it for 5 years. Akhirnya kita terpaksa tutup because we lack of fund.
Tak ada dana. Itu memang very typical story.
Just kita a few lecturers.
Betul. Such a noble cause.
Kita buat kerja di penjara, kita bagi dia ceramah, bagi dia ilmu. They want to change. Tapi bila dia keluar, tak ada siapa
nak bagi peluang.
Mereka.
Betul.
Kita cakap senang, senang bila kita kata kita akan, what we did was dia keluar je penjara telefon, dia orang ni nak keluar, kita bawa ke situ, kita carikan mereka kerja. We do like mula-mula just jual nasi lemak, buat laundry and all that. Lama-lama dia get kerja. Bila dia ada, sekarang penjara dah ada program dia sendiri. Parole tu dia dah arrange. Juga dibebaskan lebih awal tu kan, mereka juga ada set of tempat kerja dan sebagainya. That works very well. Tetapi kenapa kita adakan program itu? Sebab masyarakat susah nak terima bekas-bekas ni. Betul. Termasuklah bekas pesakit mental, bekas banduan, bekas penagih dadah. And itu saya rasa you really need to go deeper into the community, fahamkan mereka. Yang mungkin faham adalah orang yang melaluinya dan orang yang ada keluarga yang ada masalah seperti itu. Sedangkan dia boleh hidup normal.
Yes.
Kita akan rasa, I mean, I masa kecil lah, as I told you, my father imam kan, dan kadang-kadang bila dia nak kahwinkan orang, the father will come to the house, cakap-cakap, and then my mother will say, oh, the father tu dulu was, you know, came from the prison and all that. So I kata, oh, it's like satu kampung tahu what the background. Tapi kesian, why must you punish the children kan? Walaupun bapak dia ex-convict. Sama juga kalau bapak dia tu ada mental issue or mother have mental issue.
Yes.
People will say nanti adalah yang cakap mental health issue ni keturunan lah, what not. No, it's the environment, how it happened. Dan saya dapati bahawa perkara-perkara dalam rumah tangga yang menyebabkan, to me, wanita lah. Wanita menjadi pesakit mental sebab suami dia yang gila kan, dia jadikan dia orang gila. Kalau you talk about
ada trauma
tu, yes, kalau kena pukul, kena verbal abuse, you really can become mentally disturbed person. So bagi saya, kefahaman itu perlu diserapkan sampai ke bawah. And of course, there are cases anak yang melihat mak dengan ayah yang bergaduh dan verbal abuse from the father,
mereka berisiko pula.
Mereka juga mengalami sakit mental in the end. And they will do the same to their families. And that
if we don't break the cycle.
Itulah yang bagi saya keturunannya, bukan nothing to do with
that's generational trauma.
Yes.
Yang tak pernah di-address.
Kalau nak beri mereka faham, somebody has to do this really daripada kampung ke kampung, from all TV station must have commitments toward mental health issue. Terangkan kenapa it happened, why it happened, and it can happen to
anyone. Yep.
So itulah yang sangat penting sekali. And then kita juga, you must have passion in it.
Oh, definitely.
Bukan saja ada sympathy, not empathy, you have passion, baru you akan faham macam mana nak lift them up. Kalau you cakap, I understand, oh, you boleh tak you buat macam ni. Kalau masa you beri counselling to someone who is actually sedang dalam keadaan depressed, suppressed and traumatized, you cannot say things like that. So you kena nak tahu juga, you have to learn the skills of talking to them.
Definitely.
Dia bukan boleh siapa-siapa saja. So itu saya rasa sangat penting. Dan memanggil, kalau within the community ada yang have suffered and have become better, dia bercakap sendiri supaya masyarakat faham apa dia rasa, kenapa dia dipinggirkan. Betul. Dia rasa itu yang menyebabkan dia bertambah sedih dan sebagainya. So these are the things that we need to start from now. Sebab just one or two, and then maybe kita perlu jugalah pengarah-pengarah filem ni nak buat drama, do it in a way that you really menyelami perasaan mereka.
Betul. Do it accurately kan?
Yeah, do it accurately. Bukan for movie sake.
Bukan sensationalizing.
People will understand. People kata, oh yalah, I think we have done these people a lot of wrong things in our life. Kita juga perlu minta maaf. And I think our recent,
kita juga contribute.
Yes, yang recently that handicap person yang
you yang kena pukul tu.
You yang kena pukul tu kan, kita rasa macam, ya Allah, kesiannya. Betul. Bayangkan masyarakat kita sanggup buat. Saya
dan lain tengok je buat tak tahu.
Dan orang lain jadi
bystanders.
Saya pernah at one time there was a case yang this boyfriend kepada mother of the child bawa budak tu pergi because mother works kan, the boyfriend bawa budak tu pergi dekat padang bola. Budak tu disturb dia main bola, and he actually punch and kick the child. Ada berapa orang? 11, 22 orang di padang tu did nothing, and budak tu mati. And that was a case. And I came out in the paper and I said, what is this 22 young healthy people doing? Pandang saja. Kalau saya tarik dia, bagi dia one penumbuk, tak adalah sampai budak tu mati. This is the problem with us. Seorang pukul orang upaya, yang lain pandang, tak buat. Oh my goodness. Betul. tak ada hati perut, tak ada belas ihsan.
Tapi I think that's a good lesson kan. I mean, I think that's a good wake up call in the sense where inilah the reflection of our society sebenarnya.
That's right. So kita, kerana kita kata ni orang gila, need to be punished. No, dia mengalami masalah. We need to help him. Bukan dia treated him like that. Kesian. I mean, saya rasa macam manalah pergi rasa belas ihsan
humanity kita kan. Betul.
We have lost that.
Lost on it. Betul. Really thank you very much, Prof. Mungkin Prof, I just wanted to pull one thing because I'm sure, you know, me including of course and many out there, sebab tadi Prof ada cakap when you worked in the prison, ialah kita ada the people who walk, kita panggil the last mile, the death row ni kan, Prof. What is the state of the mind during the time, and what are the supports that are available psychologically, emotionally for these people for this very last mile?
So, to me, it's like that waiting. Some of them are already there in the prison, maybe
many years.
Some of them at maximum of 10 years before they actually being, kena digantung. But the one that I met was like dia dah exhaust semua, dah habis lah, dah mohon pengampunan. Ada one or two masih menunggu keputusan pengampunan. And some of them kalau dia dapat pengampunan, dia kena penjara je lah, tidak digantung. But one actually I feel that dia macam dah putus asa. Dia macam well, dia kata tak ada apalah, dia kata I'm just waiting for time sebab pengampunan pun dah tak ada.
Tak dapat.
Kan. Kata you never know. Itu kuasa Tuhan. And I talk about bagaimana Tuhan yang berkuasa. And then I told her a story that was told to me by pengarah penjara, that a person that was sent already dekat tempat nak gantung tu, dia ada bilik kan, bilik menunggu sebelum dia digantung. Dan dia dah duduk situ dah 2 malam. Early morning tu patutnya dia digantung, but malam tu they got
pengampunan.
Yes, perintah daripada istana bahawa dia diampunkan. Tak jadi. Itulah kuasa Allah. Saya kata just a day before, malam tu dia dapat, patutnya pagi tu dia nak kena gantung. Then dia dibawa balik ke penjara biasa kerana dia tak jadi digantung. Saya kata you mesti percaya kepada Allah. Dan kemudiannya I told her, I said, bagi saya you lah orang yang sangat beruntung. Sebab apa? Sebab you dah tahu dah yang nak mati. Kalau saya tak beralih dah sembahyang, saya berzikir, berdoa.
You can prepare.
Sebab dosa kita dengan Allah akan ampunkan. Bertaubat dan berdoa. Dan kita tak tahu, Allah kadang-kadang kita tiba-tiba Allah menyahut, mengabulkan doa kita. Kita tak tahu. So I said, you are fortunate enough to know when you're going to die,
and prepare for it. Betul.
Itu saya rasa kekuatan zikir, itu banyak kekuatannya, and itulah saya rasa yang dia perlu diberikan pada masa-masa menunggu saat kematian. But I think berapa ramai orang yang nak pergi prison officer, dia kata kami masa nak gantung je lah, the doctor will come and all that, but the ustaz will come sebab dalam penjara sangat ramai, so and they will not be able to do that every month, things like that.
That's so powerful lah, Prof. I think bila kita fikir dalam keadaan macam tu, saya fikir macam mungkin takut, panik, macam-macam benda yang berlaku. Tapi betul lah macam Prof kata, sebab untungnya dia tahu bila dia nak mati. Kita tak tahu sebenarnya, mungkin kita tak prepare, na'udzubillah. Tapi they can prepare to the day that they will be. Betul lah tu. Thank you.
Sebab I told that same person, I kata, I have a friend who died in between the traffic lights. Dia bawa kereta dengan wife dia, traffic light tu merah, dia berhenti. Bila hijau, he died. Dekat kasin. And then wife dia kata, jalanlah bang, jalanlah. Lepas tu tengok, so I kata, kita tak tahu. We
betul.
could just die kejap-kejap.
Any minute.
Itu kuasa Allah. So I kata you must think that you are very fortunate.
MasyaAllah. Alhamdulillah. Terima kasih banyak-banyak, Prof. Okay. Thank you very much, Prof Aziah. We will take a short break and come back for the last segment. Sekejap je ni. Tinggal lagi mungkin dalam 5 minit for the closing, insyaAllah. Alright. Thank you so much, everyone, for staying on. Please stay tuned. We will be right back in Real Conversations with Anita after this. Prof, now to conclude, dah pun orang kata last segment ni, cepat je masa berlalu. Maybe Prof, if you can share with us what are SUHAKAM punya next steps kalau kita bercakap tentang advancing human rights in Malaysia, and of course in regards to humanisation of mental health juga.
Well, at the moment, of course, this SUHAKAM, we have so many issues,
So many things,
many issues, so many things that we are going to do. We have already worked out our 2025 work plan,
Okay.
and also finishing off our strategic plan for the last 5 years too.
Okay.
But moving forward, I think we, even at SUHAKAM itself, we have 100 staff. Also, even for SUHAKAM, kita memang dah ada peruntukan staff. Kalau dia ada isu-isu yang tak selesai, they can actually talk to counsellors or psychiatrists. Kita memang ada beri that ruang, you know.
Okay.
I mean, mental health issue ada di mana-mana.
Betul.
Kerja.
It doesn't discriminate.
Yeah. So let do it first with us lah.
Yalah.
Dengan kita. That's number one. Number two, I think with the CRPD nya report,
Okay.
we would probably do a little bit more on the mental health issues.
Yes, please.
Kita nak juga memfokuskan, because ada grup-grup tertentu yang kita mesti bercakap dan listen to them, and how we could actually come up to that standards of the CRPD's conventions. Yeah, so
Okay.
that is something that it may be a big climb, but kita will move forward towards that.
Okay.
Dan saya rasa itulah yang sangat penting bagi SUHAKAM at the moment,
Alright.
untuk move forward dalam CRPD ni. Sebab yang lain kita ada CIDO report,
CRC
is going to date this year, and hopefully CRPD 2026 tu we have a lot more, consult a lot more people, get a better alternative reports. Of course kita akan hantar report after the government send
Yes,
report.
betul.
But at the same time, kita memang selalu ada consultations with the government, and that I think would give us, and we know the gap.
Yes.
Kita tahu the gap. So itu tak semestinya kita nak tunggu government menghantar laporan
Betul.
baru kita nak buat. Because we knew the gap. Kita cuma tengah tunggu akta, pindaan akta itu setakat mana dia boleh improve certain things, dan juga the Mental Health Act tu.
Okay.
Itu juga kita perlu lihat secara detail supaya dia boleh membantu untuk kita mencapai tahap antarabangsa itu.
Okay, Alhamdulillah. I think for kita SIDO, CRC, okay, good. CRPD mungkin sebab kita masih ada lagi 2 articles that we haven't ratified, optional protocol, of course included kan, Prof. Okay, so we look forward to that very, very much. Thank you, Prof. From everything that you just shared, I think that was a lot, and I thank you. I think all of us have learned quite a bit just from this maybe 45 minutes with you. Mungkin, what is your message with everything that you have experienced, not only orang kata your upbringing dan sebagainya, looking at your dad, tetapi more so in the works that you have done, your experiences, listening from the people who have gone through injustices in life dan sebagainya. Mungkin apa pesanan Prof kepada kami yang di luar sana ni? From the outside looking in, how do we do better, Prof?
Well, to me it's like, you know, mesti selalu bersedia untuk mendengar. We must try to become a listener.
A listener, yeah.
Dan saya rasa kat Malaysia ni kita kurang pendengar.
Betul. Banyak yang bercakap.
Kita rajin bercakap, tapi kita kurang mendengar. Kalau dengar pun, there is a difference between you're hearing
and listening,
whether you're actually listening to what is being said. Dan semua orang perlu ada ruang untuk bercakap dan menyampaikan perasaan hati dia. And kalau tak ada ruang tu, things will get worse. Dia peram, dia macam gunung berapi yang
tunggu nak meletup
dan mengumpul tenaga dia. Betul. Satu hari dia meletup, not in a good way, in a bad way. So bagi saya, ruang itu mesti ada. Communication must always happen in families. Mesti berusaha untuk bercakap antara satu sama lain.
Betul.
Dan kemudian kan kurangkan ni zaman moden, with children, kurangkan gadget modern ini.
Oh, yeah, betul.
You must have time with kids, talking, hugging, and itu saya rasa dapat menyelesaikan
banyak
half
masalah.
of the problem first. And then within your own family, kita mula dengan keluarga kita, dan kemudiannya extend it to our neighbours, talking to them, talking it's really important talking and listening to what we are talking about. So itu saya rasa sangat penting. Dan kita semua bukan manusia yang perfect. Kita semua ada masalah kita masing-masing.
Betul.
But at the same time, kadang-kadang daripada masalah kita mendengar orang yang ada masalah dan kita bersyukur, ya Allah ya Tuhanku, masalah aku taklah seteruk dia dan saya boleh bantu dia kerana saya juga pernah melalui.
And also maybe help us from listening to their stories, kan?
Definitely. Dia memang kadang-kadang kita rasa macam, oh, dia dah melaluinya, dan kita juga kadang-kadang
kita ambil iktibar, kan?
Kita tak realize kita melaluinya.
Betul.
But it's always important to listen and then try to help as much as you can.
Alhamdulillah. Thank you very much, Prof. Aziah. I think a very wise, orang kata wisdom from you, of course. Sedia untuk mendengar. Banyak yang bercakap, mendengarnya kurang. Difference between hearing and listening as well. I think very important to be intentional as we are listening, being mindful. Hadirkan sifat empathy dan kasih sayang. And I think one of the things that I've learned a lot apabila kita mendengar ni also is to engage in difficult conversations. I think always now when I have conversations, I challenge myself. Bila kita rasa ada fear tu, kita cuba challenge diri kita. Okay, let's have a difficult conversation a little bit more today. Daripada situ we will understand more, sebab kita deepen our understanding, insyaAllah. And of course within that conversation, vulnerability perlu dihadirkan, sebab sudah tentu bukan mudah, ya Prof. And I like what you said with children tadi. Kurangkan gadget tu satu paling penting, tapi keduanya adalah sudah tentu berikan mereka ruang yang mereka boleh bercakap dan kita mendengar. I think it's very important. Tapi again, hugging, saya suka tadi. I think some families kurang berpeluk, kan, kurang ada human touch ni, ya Prof. Dan mungkin apa lagi tadi, bermula dengan keluarga. I think we start with our own families first, because these are the people closest to us. These are the people that we can tackle first, dan kemudian barulah the neighbours, mungkin colleagues dan sebagainya, Prof. Okay, boleh. Terima kasih banyak-banyak, Prof. Aziah. That was a lot. I learned a lot as usual. Very insightful and inspiring, Prof. I hope to see you more, and following your work as well, and of course the whole work of SUHAKAM. We wish you all the best. Thank you so much. All right, that is it, folks, with Prof. Dato Noor Aziah binti Mohd Awal with our conversation heading towards humanizing mental health care, advocacy and education. So please catch us every Wednesday at 6 p.m. on Real Conversations with Anita via YouTube and also Spotify. Thank you very much, everyone. Please take care of yourself and please take care of one another.